All right. So just briefly, the objectives of this session, we're going to start out by just introducing the concept of implementation science. For many of you, this may be a new or maybe just a concept you're not very familiar with in your work. And so we'll give a bit of overview. We'll talk about some examples of how it's been used in WASH. We'll talk about today that it's not been used a lot necessarily, but there are some good case studies and examples to build on. And then we want to work with all of you to identify some key priorities for implementation science in WASH. Of note, there have been several major funding calls from USAID and from other donors and funders that look at implementation science, implementation research. And so we want to really think through what are the key questions that are of importance to the sector that can be addressed with this approach. So I'll start just with a quick overview of implementation science, why it's important. This is particularly from my perspective. I'm sure the panelists can all share from theirs as well. But yeah, we all know that we're not progressing quickly enough towards this SDGs to reach SDG 6. We've seen in recent JMP reports and so on. We all want to try to use available evidence to design effective programs. But evidence always comes from a particular time, particular location, and what works can vary across countries, across contexts within countries, within different populations, even at the same place and time. And so trying to think about how to take something that works at the level of the household or the village and think about scaling it is really challenging. And so what we need is a way to figure out what drives a program to work in a particular place and time, based on the context, to assess that and be able to use some rigorous methods to generate that evidence and help us to really learn, what it is about the intervention that's working in that place and time. Anyway, without further ado, I'll pass it over to the experts. We've invited several researchers here today from Emory University and University of Washington to share about what implementation science is and how it's been applied in the WASH sector. And yeah, I'll pass it over to Sabrina Hawk. Sabrina, over to you. Oh, I'll make sure.
Thank you, Ben. So as Ben mentioned, my name is Sabrina Hawk. I'm a PhD candidate at Emory University. And I've been at Emory since 2017. My dissertation work is studying ways to improve the delivery of Rwanda's community-based environmental health promotion program. And then before coming to Emory, I was with the World Bank doing mostly operational research on our water and sanitation portfolio. So getting into this field of implementation science felt very natural for me. I think I read my first introductory paper to the field probably 6 years ago or so. And I was like, yeah, this really speaks to me. I get it. I like this. Then I dug a bit more into the literature, read a few more papers, and I got completely overwhelmed because there was just so much to the field, so many diverse applications across sectors, different frameworks, and then new evaluation methods I was just not familiar with. But now with a few years in, I've been doing a lot of reading, talking to a lot of different implementation scientists, and then applying some of the thinking to my own research. I finally feel like I have a grasp on what implementation science is all about. And so in the next 10 minutes or so, I'm going to try my best to summarize what I've learned and appreciated the most in the field. And I'll focus on 3 questions for this introduction. The first, what is implementation science? Where does it come from? Who does it and why? The second, how is implementation science any different from what we are already doing in the WASH sector? Many of us do implementation research. Many of you already incorporate implementation science objectives into your work. So what's the real added value of this type of branding? And then I'll try to answer that in the latter half of the introduction. And then finally, how can it be applied to WASH? I won't spend too much time on this. I'll let Johnny Crocker, the next presenter, really talk about how he's applied some of this thinking in his research on CLTS. But I also wanted to give a plug for a paper that I published with Matt Freeman over the summer that can be found in EHP on the applications of implementation science. It gives an overview of the field and just some ways that we think that it could be used in our sector. But I'm going to begin with the most traditional definition of implementation science, and that is the scientific study of methods to promote the systematic uptake of research findings and other evidence-based practices into routine practice, and hence to improve the quality and effectiveness of health services. So the field originated in healthcare, specifically in high-income countries, and researchers were essentially interested in how we can get clinicians to use new evidence faster when working with patients. But since its original inception, a lot of different sectors outside of healthcare have grasped onto this basic concept of rigorously studying delivery and real-world implementation. So many implementation scientists will say that they focus on closing the no-do gap. That is bridging this very stubborn and persistent gap between research and practice. And they do this by attempting to answer this central research question. How do we deliver what works to the people that need them the most with greater speed, efficiency, fidelity, and coverage? And so on this next slide, we have a framework on sort of the traditional phases of research. Now, starting on the left, first we ask questions on basic plausibility of an innovation. Should it actually work? What's the biological plausibility? Why should this work? Next, we test it out in an efficacy study, trying to really show the causal impact of the innovation. And then we want to see if it works under real-world conditions. You may answer that effectiveness question in a field trial, for example. But then implementation scientists work more in this last portion of the framework. They work throughout all phases, but they've really contributed a lot to this last half, trying to understand how to make the intervention better. How do we optimize the delivery, and how can we get it ready for adaptation and scale? So now I'm going to share one more framework that goes a bit deeper into a few of the concepts that implementation scientists will study. And so one critical feature of this framework is that it's going to break down the intervention by its innovation and implementation strategy. So an implementation scientist would say that you have to study both components to design an evidence-based intervention. And in WASH, we can think of different innovations as various types of WASH hardware, your pipes, toilets, tippy taps, your programs like CLTS, community hygiene clubs, different WASH policies. But then what is that implementation strategy that you're going to pair that innovation with? What are the specific processes that need to happen for that innovation to be delivered and actually benefit its target population? And then next, how does a specific context limit or promote this intervention from reaching key outcomes that will lead to public health impact? And I think that's really where we struggle as a sector. Many of the recent trials that showed limited health impact, they stem really from our inability to reach key outcomes in coverage and use. And so how can we better study that, and how do we reach those implementation outcomes first? All right, so now that we've gone through some of the fundamentals, I'm going to summarize what I think are really the hallmarks of IS. And first, it pushes us to adapt pragmatic research models. It's going to prioritize evaluation methods that will study how an intervention works rather than just if it works. So good process evaluation is really stressed in the field, ones that can systematically document delivery of an intervention and show the theory of change of how it really achieves specific outcomes. And then next, there's this lower reliance on traditional randomized controlled trials. Implementation scientists will use something called hybrid trials, for example, which is a trial that will test multiple implementation strategies paired with the same innovation, and then compare their effectiveness and often cost effectiveness when recommending an intervention. And then next, there's this emphasis on context, aiming to improve the generalizability and assessment of contextual fit of an intervention. How can you determine if an intervention is appropriate for a certain setting and how it needs to be adapted? And then importantly, the field very much strives to be multi-stakeholder and demand-driven. We want to ensure that we are asking research questions that are actually aligned with the interests of implementers and policymakers. And so this concept really recognizes, especially in WASH, that implementers have very diverse objectives. So in the WASH sector, we're not only working to improve health outcomes necessarily. Implementers might be operating within a financial model of service delivery, a sustainability lens, a gender lens, just simply using a rights-based lens to increase coverage. So how do we help them with improving their processes to meet those organizational goals? And then there is this significant emphasis on co-creating knowledge with local implementers. One, that's because it will help you frame the right types of research questions, and then also because it will help you conduct research under more real-world conditions. And then also, it's going to help promote the uptake of research findings within organizations, hopefully improve that transfer of scientific skills that will improve their ability to continue and build upon this type of research. And then the last hallmark that I'm going to mention is this use of diverse theories and frameworks in the research process. So there is a different theory or framework or approach to guide you in everything from assessing context, designing interventions, evaluating implementation, and then translating and disseminating knowledge. And really what this does is that it tries to promote structure and a shared language to systematically look at implementation. And as I've mentioned before, a lot of different sectors use implementation science, and as a result, there's been this huge proliferation of different types of frameworks that are specific to a sector. There's actually a review in 2015 that found that there are over 70 approaches that are used in the field, and that number has surely grown since 2015. But the authors find that most of the approaches can fit within these 5 categories with 3 broad objectives. One is, how do we translate research to practice? What's the guiding process model for this? How can we design interventions and better understand what influences implementation? And then finally, what are the different frameworks that are appropriate for evaluating implementation? So I would say that implementation scientists have maybe their favorite 5 or 6 frameworks that they like to use. But the point is that these frameworks are widely available for different use cases, and you can pick the ones that are most applicable to your work. And I believe Johnny and Matt are going to discuss a bit more on the application of some of these approaches later in the presentation, and where you can find some of the common ones that are used. So with that, I am going to pass it over to Johnny. Oh, no. I just stopped the sharing.
Just a second, I will get sharing back going. Okay. All right, Johnny, you should be good to go.
All right, thank you. So hi, I'll introduce myself. My name is Johnny Crocker, and I'm a postdoctoral researcher at the University of Washington in their Department of Global Health, where I'm a part of their implementation science team. And I've been there for about 4 years now. Currently, I spend most of my time on cost analysis, economic evaluation, and process analysis of maternal and child health, HIV, and nutrition programs. So there's not a lot of WASH in there at the moment. But previous to joining University of Washington, I was at the University of North Carolina and did my master's and PhD with the Water Institute. So today I'm going to talk a little bit about how I stumbled into the field of implementation science, and I think stumbling into it is really the best way to describe it. Some of the things I learned along the way, some things I did right initially, and then some of the things I could have done better. So when I was at the Water Institute for my PhD research, I had the opportunity to work with Plan International on a multi-country community-led total sanitation, or CLTS, evaluation. And UNC was approached by Plan International and the Gates Foundation to do a study that aims to understand CLTS implementation challenges and cost effectiveness, rather than, for example, the impact on health. And so this gave us an opportunity to be a bit creative about our study design and implementation. So when I started my work with Plan International, I didn't actually know the term implementation science. So a lot of this work that I'm describing here happened before I actually discovered that field by its name. But I did want to do research with immediate relevancy to implementation, which I think is where there was some overlap initially. During my graduate studies, in class and in articles I read, I came across phrases like context matters, and pilots never fail, pilots never scale. Sanitation had such and such effect on diarrheal disease. Research takes 17 years to translate into practice. That's an actual number. That's a quote from a study. And what I didn't necessarily see was articles or guidance that showed how to analyze this context, how to design programs around that, how to do a pilot that could scale, or how to take a successful pilot and transition it to scale. I didn't see many studies that compared multiple interventions or tweaked and modified interventions as opposed to comparing them to a do-nothing control to find health impact. And I didn't find much guidance on how to design research so that it would have an impact on practice. So with the project with Plan International, from the beginning, we set out to try to incorporate an analysis of context into our study design. We tried to study what we called at the time scalability by including measurement of costs, implementation process, and the role of local actors in implementation. And we compared different adaptations of CLTS to each other rather than comparing CLTS to a control. And from the outset, we tried to make sure that our research questions were relevant to our implementation partners and the governments of the countries we were working in, and make sure to design our dissemination to target those audiences. Our study design was a dialogue between UNC and Plan International. And this began by asking first, what is the main barrier that Plan or their partners were facing to effectively scaling CLTS in their country? And that became our problem statement or our research question. We then asked, how would you address this barrier? What would you do to overcome this? And that became the intervention that we would test in the study. And then, we asked, what is the most rigorous research design that fits that? And that became our research design. And throughout that, we measured things like cost, process, and intermediate outcomes. This slide here makes it look like this process was very linear and straightforward. Of course, it was actually much more challenging and back and forth than this. And we had a one-year startup period after our grant was funded. And during that 1 year, we revisited all of these questions multiple times and tweaked our study designs and research questions. So here's a sampling of some of the things that we learned during this program. I should probably mention this program started at the end of 2011. So it's been a while since this program was done. I'm not going to go into detail on our actual study designs or quantitative findings. That's all been published and presented before. Instead, I just want to show you, the types of things we learned and how they were relevant for Plan International and their partners in the study countries. So for example, we learned that CLTS worked best in small remote villages that had low prior exposure to WASH projects. And for Plan, this meant that they should target CLTS to these types of settings where it was most likely to work. Instead of targeting it to communities near where they had program offices, which often were large communities that had already had WASH projects. We did a lot of training local actors in these programs, and in some cases that increased effectiveness. In others, it increased sustainment of the outcomes. And the implication here was for Plan that they should train local actors from the outset of these projects to implement and support different aspects of the implementation. But that training was sometimes up to 50% of the entire program cost. And so Plan needed to find ways to reduce the training costs from what they were during the pilot. For example, looking for economies of scale by grouping villages together, or doing trainings in villages instead of outside to save on accommodation costs. And CLTS resulted in low quality latrines that were prone to collapsing. So, Plan needed to recognize that CLTS could not be a standalone approach and needed to be considered alongside other interventions to target supply and finance. And so, looking at these points here, a lot of you have probably heard these many times before. You know, 6 or 7 years ago when we started to say these things, some of them were fairly novel. But what I really want to point out is that, you know, the way we designed our studies led to findings that did have immediate implications for Plan and their partners. And so that in that way, we did meet our goal in designing our studies this way. So I finished working on that project about 4 years ago now, and I've been at the University of Washington since then. So, you know, now that I've been actually working amongst people who practice implementation science and studied it, you know, I have some reflections looking back on that CLTS project. So there are some things that I think we did well, and I try to continue to do in projects. We did collaborative research questions and research design with the implementing partners to make sure that it was relevant to them. We compared multiple interventions to each other. You know, I found that in many cases, if you tell your partner at the end of the day sanitation did or did not have an impact on health, or water supply did or did not have an impact on health, it doesn't necessarily change whether, for example, the government of Ghana decides if they're going to supply water to their population or not. What they really want to know is how can they do it more efficiently and effectively. So comparing interventions can yield those sorts of results. And we focused on context, cost, and process. Context specifically, we did multi-site studies, so we were implementing in different contexts and could compare our outcomes. And I think it was really important that we planned our dissemination from the beginning. So we had different types of products and events that were targeted to different audiences rather than just, you know, academic conferences and journal publications. But we definitely missed the mark on some things. You know, beyond our research questions about cost and effectiveness, we didn't really have specific research questions. Instead, we just knew that we wanted to study costs or context and process, for example, but we didn't from the outset have a focused research question and methods designed to adapt it. And we just sort of had a general focus, and that's something we could have done better. And then for these areas, we did not draw on the established methods and frameworks that existed. For example, you know, in one of our studies, we tried to design our own framework, and I think it was pretty good, but you know, there are many frameworks that had been tried and tested and used for years, and that would have been a better place for us to go rather than developing our own frameworks from scratch. A couple examples that are, you know, some of the most used frameworks in implementation science are the Consolidated Framework for Implementation Research and the REAIM framework, which expands beyond effectiveness to look at the reach, adoption, implementation, and maintenance of an intervention. And so just to summarize before I pass it over to Matt, I think that implementation science does have a lot to offer the WASH sector. It can help us in framing research questions. It can provide, you know, theories, models, and frameworks to use. It can help us identify implementation strategies so that when we do pilot an intervention successfully, we can think about how to take that to scale or transfer it to government. It can help us to choose metrics, measures to report, and how to report and disseminate results. So I think one thing I just want to point out before I pass it off is that this field of implementation science was initially applied to healthcare in domestic and high-income countries. And based on conferences I've been to, that still describes 80% of implementation science research. So if you are thinking about applying it to WASH, I would just say it's probably won't work to copy and paste methods directly to WASH. We have to think about, you know, which methods, which frameworks are relevant and how we might need to adapt them. And also, you'll see there's a lot of jargon in implementation science. It's not always the most approachable field. I think that's one fault it has. But the methods are not as complex as they might seem at the outset. So, you know, don't be scared off by that jargon. All right, over to you, Matt.
Hi, everyone. My name is Matt Freeman, and I'm a professor in environmental health at Emory University in Atlanta. And you know, I think my story of implementation science is very similar to both what Sabrina and Johnny mentioned. It's just kind of, I came to implementation science and realized I'd been doing kind of some of this work and went about trying to learn a little bit more about the methods and frameworks, and then got promptly confused. really confused because, as Johnny said and Sabrina touched on, there are a lot of different frameworks and meta frameworks and tools. And I think what I want to kind of leave as a take-home message for you all is that there is no one right framework, there's no one right approach, but these are a suite of tools, a suite of methods that can help improve the way that we do evidence generation. And it's not all or nothing. And it's about adapting some of these approaches as fit for purpose. And I think just doing a little bit of that in our work will really support better evidence generation in the WASH sector. A lot of what we're doing now, I think, is operational research, which is critically important for implementers to improve their programs. But what we're not doing is implementation science, which allows that learning to be scaled and understood and translated to new learnings across the sector. And I think that is one of the things that's keeping the sector from being able to learn more broadly. And so I'll talk a little bit about a few just kind of things that in reflecting on this, things that I think we could do as a sector to that would be incremental, but would dramatically improve the way in which we do learning. See if I can advance. Yeah. So in thinking about what are some of the challenges that we have in understanding how we can adapt and scale our best practice programs. Number one, I think we have generally a poor understanding and assessment of context. Now, that's not to say that those implementing in the field don't know the context or don't understand the context in which they work. But in many cases, the context is ill-defined from both like a local level all the way to a political economy level. And also the reporting and the way that context is adapted into programs is poorly described, which makes it very difficult to then take that program and move it somewhere else or scale it up. Number two, I would say there's minimal application of behavioral theory. And I think specifically, you could just think about the programs that you've been involved with and you talk about, well, we did a training, okay? Well, what was in that training? Was it a knowledge generation, a knowledge training where you told people something, how to wash your hands or what causes diarrhea? Or was it about modeling behavior? Or was it instituting carrots or sticks within a school environment to get head teachers to incentivize them? What were the intervention strategies that were built on these behavioral theories? And I think we need to be much more explicit in our descriptions and use some of these standard models that implementation science provides in order to translate these from program to program. The third is that we really have no standard approach to document intervention strategies and delivery. And implementation science has frameworks and processes and procedures that help facilitate. And it includes definitions of terms. So we all have to get on the same page within the WASH space to understand what we mean when we say we did a specific thing. You can think about any kind of CLTS program. What is the walk of shame? Do we understand the cadence of that? Who was there? Maybe for CLTS we do, but way more in CLTS than other kinds of intervention strategies that we or intervention that we implement. And I think the fourth is that there's, I say, minimal funding for effectiveness evaluations with WASH endpoints, but it's not just the funding. There are minimal incentives. Ben. Minimal incentives for doing WASH endpoint evaluations that compare different interventions rather than just looking at trials that look at whether an intervention worked versus a pure control. So where does that fit within where we've talked about already? So this is bringing up the framework or the flow chart that Sabrina had. So for number one, poor understanding and assessment of context. So we need to use maybe the CFR framework, and we need to prioritize action planning and implementation sciences, implementation science methods related to understanding and documenting context. Context not only of the local community, but also context of the implementers and the context of the political economy. Number two, we need to apply something like the COM-B framework or other behavioral frameworks that allow us to name the kinds of interventions we're doing. So if we say we're going to do a training, we need to be able to identify what was part of that training. And we need to be able to do a process evaluation that allows us to translate that so that other people that are reading our report know exactly what we did. And so we need more standard approaches to reporting. And there are some documents out there that outline what a good reporting of an intervention should look like. And that really needs to be translated for the watch space. And that goes along with kind of improved process evaluation methods. I think many folks in the sector do process evaluation, but utilizing kind of standard terms that are in the literature can help us understand and translate that work to other contexts. And then the final thing is to use hybrid designs that can actually test and compare intervention strategies to each other while assessing program fidelity. And so we need better assessment of the fidelity at the same time using kind of rapid randomized or quasi-experimental approaches that allow us to compare different interventions. So here are the kind of 4 priority solutions that I think that we could address. And as we kind of get to the latter half of this session here, we're going to talk about some other we're going to ask you all what you see as some other priority questions that you think could transform the sector. And I'm going to talk about a few of those now, and then we're going to come back to it for our activity. So what intervention works best? Actually, that's not a question that we should be asking. It's often a question that folks want to know. What is the best approach to improve latrines? Well, implementation science doesn't help us answer the best question. It helps us understand what would be a suite of interventions for a specific context. And so I want us to really think not about what's the gold standard of intervention strategies, but what is the menu of intervention approaches that could be used when you fully understand the context that you're working. All right, so for context, what describes the context in which implementation occurs? How do contextual factors influence implementation success or failure? These are implementation science questions. What are the drivers of implementation success and failure? Going back to what Sabrina said, how does it work? And why did it work or not work? How and why does implementation of the intervention lead to effects on access, usage, and status? And are there unintended consequences of the program? Under what conditions does the program work? Is the tool, intervention, or strategy worth it? And is it cost effective? And I would argue that you have to understand these 4 things before you can even start to approach understanding how you would adapt and scale. And you may think, well, we don't really know what in the context makes our intervention work. If that's the case, then it's going to be hard for you to try to move it to a new place, scale it up, or adapt it. So then the other sets of questions around adaptation at scale might be, how can multiple watch interventions be integrated rather than simply co-located? How do they feed off of each other? How can interventions effective in one setting be adapted for effective replication in another? What data do impact evaluations need to collect or report for effective replication and adaptation of an intervention? How can coverage and usage of proven interventions be increased while maintaining fidelity and quality? How can program outcomes be sustained post-implementation? And finally, how could program or service delivery be more equitable, and how do outcomes and impacts vary across race, class, education, gender, age, geography, and other relevant factors? And I should note that these questions were, Johnny adapted these questions from the UW toolkit that he'll orient you to towards the end of this session. And so credit to Johnny for these questions. So again, implementation science can be confusing. And I think it's really just a take-home message again. adapting some of these methods and frameworks fit for purpose for your work can help us as a sector understand how we can learn together. It creates a shared vocabulary and shared standards around what we mean by reporting and evaluating effective interventions. So Ben, over to you. Thank you all very much.
Sure, thanks. Thanks, Matt and Johnny and Sabrina. So I just wanted to pose a couple of questions that have come up in the chat, or that I had as well. Those ended up overlapping by the end, so a good sign. So I wanted to start first with you, Matt, just something sort of quickly. You mentioned hybrid designs. There was a question in the chat about, like, what does that mean practically? So you don't have to give us like fully worked example, but just some thoughts about, like, you know, what does that mean?
Thanks for that question. So I think we're all probably familiar with a randomized controlled trial where you have an intervention that you've developed and you're going to implement it in 100 villages, and then you're going to have a pure control in another 100 villages. And so what does that randomized controlled trial tell you? It tells you if the intervention was effective at changing some health impact or some outcome. That could be very useful. But what a hybrid design can help you do is it integrates several components of the process. So it might include a process evaluation where you concurrently assess fidelity. It may include quasi-experimental, so you don't actually randomize, but you might use more matching or some other design. And also, I think it doesn't necessarily require a pure control. And so you could do things like assessing intervention A, intervention B against intervention C, and then maybe do some crossover where you then are seeing whether those that got intervention B, once they got intervention A, dramatically changed the effectiveness of the program. And so, but it's not just relying kind of on this quote unquote gold standard of randomized control trials, but it's a more flexible designs that include questions around the delivery as well as the outcomes. I don't know if Sabrina, do you want to add anything to that? Or Johnny?
No, I think you covered the 3 types of hybrid trials well.
I think just to say that, you know, any hybrid trial will ask the question, what was the impact of this intervention on outcomes that we care about? But that is given equal weight to questions like, you know, can the government deliver this intervention rather than an NGO? Or what is the cost of this intervention? And, you know, is it cost effective, and can it be scaled across an entire district instead of just the communities we're working in? So questions about that scale up and that feasibility of transferring it to others.
Great, thanks everyone for those answers. And I know that Johnny put a publication about the hybrid design in the chat. I copied and pasted it over to the conference page as well. So hopefully you guys can all see that. One, I wanted to follow up with Sabrina, and then one question for Johnny as we transition to our activity. Sabrina, you were describing the process of even defining research questions and talking about consulting local stakeholders and that sort of thing. I wonder if you could speak to that a little bit, because it's, you know, it seems like this is even more, you know, sort of all-encompassing than just, you know, a trial with a specific outcome, something like that. It's a much broader kind of approach to evidence generation. Can you describe that process a little bit?
Yeah, I think it really comes to this idea of not having research teams overly manage or control and design the intervention that you're testing, that you want to ensure that you are working with the implementers that would actually deliver these interventions on the ground, and that they are the ones that are doing the implementation and designing it, and you're evaluating that, rather than having an outside research team be the ones driving the research question here. And so, you know, this process is going to look like making sure that you are having multi-stakeholder engagement, that you are working with ministries and local NGOs that are actually delivering these programs. And there will be a lot of probably capacity building that needs to take place on some of these tools and orienting them to these different types of frameworks, and trying best to really help them frame a research question that can not only inform their organization, but also be applied to the rest of the sector as well.
Yeah, great. Thanks for that, Sabrina. All right, I'm going to click forward one slide here while I ask Johnny a question. But this is a list of the questions that Matt went over and that Johnny adapted and prepared. And I just wanted to have a little bit of an activity here to ask those on the call, which of these do you think would fill an evidence gap that's not being addressed in the WASH sector? So, these kinds of questions, I think a lot of them are very important to the kinds of questions that all of us are asking. It's probably interesting for some of you. It was for me to see this and think this is almost all of the questions that I ask on a regular basis. So why hasn't this been taken up or used more widely? But I wanted to pass a question to Johnny real quick. Well, let me describe the activity and then do that. So there are 14 questions that are labeled here. And for those of you that are viewing this on Zoom and can do this, you can sort of identify which of these you think are some of the key gaps in the WASH sector. You can do this with annotation within Zoom. So if you look up at the top of where the screen is being shared, there should be a view options and then annotate as an option, and you should be able to select a stamp, a little star, a check mark, or a squiggly line, something like that. And if you can just stamp next to the ones that are sort of key evidence gaps from your perspective, and we'll have the team kind of speak to them a bit. And while everyone's doing that, you can also, by the way, pop it in the chat if you just want to put 1, 3, 5, or whatever you want to do, just so that we can we're not limited by technology here. But Johnny, there was a question earlier in the chat about implementing a program where community members already had a WASH program. It didn't work well. I know we talked a little bit about de-implementation and about even the challenge of you do a program and did it work or not? No, it didn't work. All right, what do you learn from that? So I wonder if you can just comment about kind of the role of implementation science there and understanding how you might go about sort of diagnosing that or learning from that.
Yeah, so before this session's over, I'm going to share a resource page that my team at University of Washington has developed for implementation science. But some of these models and frameworks are designed for exploratory research, which we haven't actually put a lot of questions on this page about those. But that's if you have an outcome that you're trying to affect, you can do qualitative exploratory research to try to understand what sort of interventions might work or why past interventions have failed. So I don't think I can directly answer the question in chat about what works where WASH programs have failed in the past. I did see that CLTS doesn't tend to work in my studies, but that doesn't mean that my research told me what does. But I think, backing up from testing interventions, which is something we like to jump to in WASH, and instead slowing down and doing some qualitative work, and if you're looking for terms, look up, formative research or exploratory research as a way to try to discover what types of interventions might work. So that doesn't give you an exact method or intervention, but that's my reflection on that. I think there are some people in WASH that do that sort of research better than I do. I know I've seen some qualitative research in the participants list who are pretty good at that.
Mm-hmm. Thanks, Johnny. So I wanted to look at some of the results here of the prioritization. So I see a lot of marks next to number 6 about under what conditions does the program work. I see quite a lot under or next to number 12 for how can program outcomes be sustained post-implementation or after external support. Also several others, something about how and why does the intervention lead to effects on access, usage, and status, number 4. number 13 about equity is often a key question. Yeah, I wanted to pass to the team. We were discussing this a little bit beforehand. Questions like number 11 and 12, scale up and sustainability, how they're often, priority questions we want to address, but there's often some key barriers to being able to address those questions directly. So I'm wondering if some of you can speak to how implementation science facilitates that, but facilitates it with maybe a little bit of groundwork, so to speak, beforehand.
Ben, before I address that, or specifically, I just want to point out number 6 and number 12, and just thinking back to what we need in the sector in order to answer these questions. So we need to know what we mean by conditions. And so it goes back to the need to better document context. And so think about, to participants, as an exercise, think about how you might describe the context, or how you've seen the context of a program be reported. It often might be just a paragraph about how agricultural or what the WASH coverage is. But there's rarely a discussion about what the political economy is. It's rarely a discussion about the roles and responsibilities at the national, district, and local level in terms of service delivery. There's rarely a discussion of, there's rarely a mapping of all the key stakeholders, both within the WASH space, but all of the boundary partners who operate in the space. What other NGOs, what other CBOs, what other ministries have interest in that space. And so we don't have a good way in the sector of reporting context. And if we're going to answer any of these questions, we need to be able to have a shared language around that, so that I know when Johnny says, this was the context, he's reporting it enough so that I can look at my context, assess my context, and say, these are the key differences. And this is how I will adapt my program that was so successful in where Johnny did it, so that I can do it where I'm working, because there's this main difference in political economy. What do I mean by that? Just an example would be, maybe Johnny delivered his CLTS program through health extension workers that are very well supported. But where I'm working, they're not well supported. Now, if I want to roll out my intervention with using health extension workers like he's done it, I need to understand how I'm going to motivate those health extension workers. What incentives am I going to provide? And then the second is the word program. What does that mean? And again, thinking about how do we define interventions and how do we write them up? Everyone go back and think about how they might describe their program. Is there enough information so that someone could take that program that you delivered and put it somewhere else, and then assess the context and adapt it? So just to point out, these things are so fundamental that we need to know. We lack the vocabulary within the sector to actually do those things. So over from me.
Yeah, thanks, Matt. I don't know if Johnny or Sabrina, if you want to say anything more about that.
Yeah, no, I sometimes think of these implementation science frameworks as kind of like cheat sheets of a way of not needing to have necessarily the political science expertise to do a really great PE analysis, but I can have at least a framework that would let me think about that and assess the needs that maybe I need to hire a political scientist to do that evaluation instead. And it broadens your thinking and it's kind of like a checklist of what you really need to be thinking about.
Yeah, thanks for that, Sabrina. Yeah, Tomby's putting some notes in the chat. Yeah, political economy analysis often, not considered at this scale, done by policymakers rather than programmatic implementers, but it so obviously affects all the programs we implement and the mechanisms that we use. I think the worst possible outcome of this session would be for everyone attending to learn all about these really interesting things and then not be able to actually do anything with them or no next steps. So I want to pass over to Johnny real quick. He's going to share a little bit of a resource that's available that can help with this. Again, I think it's important, as others were saying earlier, this isn't a 5-step exact process. You have to do 1, 2, 3, 4, 5, but to have some tools and things that you can use and adapt, I think is really helpful. So Johnny, I'll pass over to you. and let you share your screen. Let's see. All right.
All right. Can you guys see my screen right now?
Yes.
Okay. And I just put the link to this webpage in chat. So there are many places you can go to find implementation resources, implementation science resources. This is one that I'm quite familiar with since it's developed by the team I currently work with at the University of Washington. And you know, again, I want to point out this resource here is designed for use in healthcare in high income and low income countries. And so, like Sabrina said, you know, some of these resources may look like a cheat sheet, but we still need to be deliberate and think through, you know, does this framework or does this method apply to WASH? Why might it work or why might it not work? But the research questions that we were just looking at and voting on, you know, they're adapted from some early implementation science literature from over a decade ago, or from about a decade ago. And I borrowed all of these themes here for research questions, but I rephrased almost every single question on here because I thought in its current phrasing, it was either, you know, had more jargon or complexity than it needed to, or was relevant to healthcare, but not WASH. So I came up with, you know, a modified question about replicability that I thought was relevant to WASH. So just one way of thinking about how to frame your research question and how research questions in healthcare might need to be different for WASH. After you've developed a research question, you need to think about how you are going to answer that question. And in implementation science, we typically look to these models and frameworks that have already been developed and used many times. And so Sabrina showed this diagram here where you can think about, is your research question related to, you know, describing the intervention itself, understanding how to translate it to implementation, or how to report, for example. And so once you've determined where your research question fits in that figure, you can come down here, and of the 70 plus frameworks that exist, we've recommended, you know, a few of our favorite frameworks for answering research questions that are around process or around determinants of success and failure. The CFR here, Consolidated Framework for Implementation Research, which is better called the CFR because that's much more simple, is one of the most used frameworks in implementation science, and I think much of it is relevant to WASH. And then, you know, there's not much here about context, because in healthcare, the context is very often the healthcare facility, and there's a lot of similarities from one to the next. And so we don't, in WASH, you know, we're out working with many different types of organizations in many different environments. I think context is a methodological gap that we may not be able to fill just by looking at implementation science frameworks. But when we look for evaluation frameworks, this REAIM framework, for example, and implementation outcomes framework at the bottom of this page, I think are very useful, and we could learn a lot from those. So I've shared the link for this in the chat, and I think, you know, if you're interested in applying implementation science to WASH, this would be a great page to spend a couple hours exploring, just to think about, you know, rather than going to Google and typing it in, you can maybe start with some articles that'll be a little bit more efficient for your time, a little more bang for your buck if you're trying to invest in this. And then Ben, I think you wanted to say a few things in the last couple minutes before we close out.
Sure, great. Thanks, Johnny. Yeah, really appreciate all the presenters today. You know, just again, reflecting from kind of my position, you know, my role is to try to think about what is it like to learn across WorldVision programs across, you know, 41 countries where we implement WASH, where contexts are different, programs are locally determined. It's not like here's these 5 steps that are done everywhere. And so, yeah, just, you know, personally within our organization, I think we have a huge appreciation for the way that being able to identify context and to do that in a systematic way could really inform programmatic approaches. Just a couple of reflections on things. You know, one, someone said earlier, yeah, the question of does this work or not is not always the most relevant or applicable. You know, the government's going to be implementing sanitation programs. So if I say this approach had a 7 percentage point increase plus or minus 3 percentage points, like, what's the government going to do with that? The alternative is not nothing. And so I think this sort of like hybrid design model, this sort of learning with context in mind, is really important. And I think, one key point to make is that, often when we're looking at government programs or NGO programs or any kind of programs, the questions are, does this thing work? And, speaking from experience, nobody really cares that much. Does WorldVision's approach to this work or not? It's unlikely that another NGO or another government is going to just take that thing up wholesale, but to say, what is it about this approach that works in this context? What is it that we can learn and incorporate in our programs that these governments can put into policy? I think that that learning and that ability for all of us to learn from each other is really strengthened by implementation science. And so, I hope there's opportunity to use these within organizations. I think, if nothing else, looking at Johnny's slide about learnings from CLTS, those are much more practical kind of learnings than I've seen from a lot of research studies. Hopefully there's opportunity to incorporate this, as Matt was alluding to at one point, into, relatively easily into implementation. It doesn't require, vast amounts of resources to do a randomized controlled trial and try to hold out a control area. If anything, if we know anything as implementers, there's no real such thing as pure control in a lot of these field trials. So I just want to again say thank you so much for everyone who came and participated today and asked questions. Thank you to our presenters. There are resources in the chat. They're also listed on the website, some of these papers and websites that everyone's been referring to. If anybody else wants to, correct or come in with something I just said, you're welcome to. But otherwise, thank you all so much for attending, and enjoy the rest of your conference.
Ben, you want to stop recording?
Oh yeah, that makes sense.